Very good morning, my dear student. I am Dr. Parvez Ahmad. Today I am going to talk about the oxytocics. Oxytocics is also called uterine stimulant and also known by ecbolics. Oxytocics means these are drugs which increase the uterine contraction. That is called oxytocics. Okay, before the discussion, first you see the learning objectives. At the end of this session, you are able to understand different type of oxytocics and their mechanism of action, usage and side effect, and some important contraindication of oxytocics. Now the classification of uterine stimulants. First one is the oxytocin. We know that oxytocin is secreted from posterior part of the pituitary gland. Second drug is the ergot derivatives or ergot alkaloids, ergometrin. Ergometrin is also called ergonovin. And second one is in this category is the methyl ergometrin. Methyl ergometrin is a more potent than the ergometrin and also longer duration of action of compared to the ergometrin. Now, next categories of the oxytocics are prostaglandins like PG2 derivative dinoprostone, PGF2 alpha like dinoprost, and 15-methyl PGF2 alpha is carboprost. These all are the drugs which are the example of uterine stimulant or oxytocins. But mainly nowadays, oxytocin and ergometrin we have used for the uterine stimulant purposes. Prostaglandin analog or derivative also you have used for the cervical ripening. Now the oxytocin. Now the individual drug we are going to discuss. Oxytocin. See here the effect of the oxytocin on the different organs. First one is the uterus. We know that on the uterus which contact the pregnant uterus. On the breast which contact the myoepithelial cells and resulting of the ejection of milk. Now the next one is on the cardiovascular. At a small dose, oxytocin produces vasodilatation, may cause transient hypertension. On the kidney, we know that they are the drugs which are secreted from the oxytocin posterior part of the pituitary. There's action similar to the ADH. Okay, that's why have a weak antidiuretic and pressure activity due to the stimulation of vasopressin receptor. Now here see the effect of the oxytocin, how regulate on myometrial activity. See here nerve impulses from the cervix transmitted to brain. See here in the picture which stimulate the pituitary gland to secrete oxytocins. Okay. Now, next one is oxytocin carried in the bloodstream to the uterus. Oxytocin stimulate uterine contractions. Head of baby pushes against the cervix. So these are the effect of the oxytocins. Now, related to pharmacokinetics of the oxytocin, it is given either by intramuscular or IV, but mostly we have given by the intravenous routes. Mostly we have given by the IV infusion, allow for the fine control for drug concentration and uterine contraction. Half-life is a very short, approx 5 minutes. The next is the mechanism of action of oxytocin. Basically, oxytocin act by the G protein coupled receptor. First, oxytocin bind with the oxytocin receptor, which are present in pregnant uterus, and finally, IP3 and DAG secondary messenger is formed, which are responsible for the influx of the calcium ion. Once calcium ion is in influx, which phosphorylate the MLCK, and finally, uterine contraction takes place. So these are the simple mechanism of action of oxytocins. Now, where you prescribe such type of the drug, that is what is the therapeutic uses of the oxytocin. First, we have used in case of the prolonged pregnancy for the induction of the labor. These are drugs which induce the labor, and they produce the rhythmic contraction. It provides the full relaxation in between the contraction. That's why these drugs are preferred in case of induction of labor. Also, sometimes we have used in incomplete abortion. And then sometimes you have seen the if pregnant ladies are diabetic, preeclampsia, premature membrane rupture. In that case, we have used oxytocin. And also oxytocin we have used where the poor progress of the labor to augment the labor. Also, these are drugs we have used for the PPH. Now the next one is the lactation aids. Oxytocin also we have used intranasally to ejection of milk in case of the engorgement of the breast. But these all are the clinical uses of oxytocin. Now the next one is the unwanted effect of the oxytocin. First one is a uterine hypertonicity, maybe increase the tone of the uterus, may cause rupture of uterus, maybe impair the fetal circulation, maybe water intoxication because of the ADH property. Now the next one is a contraindication. Contraindication of oxytocin is also very, very important. Now the first one is a oxytocin is not given in the placenta previa. What is a placenta previa? Sometimes placenta is implanted lower part or segment of uterus. In that condition, placenta previa is that is oxytocin is contraindicated in a placenta. Again, placenta previa is a various types, marginalis, lateralis. Okay. Now the next one is a fetal stress. If in that condition also oxytocin is not used. In case of the abnormal fetal presentation, uh, like a breech presentations, in that condition also oxytocin is not used. Oxytocin mainly we have used in a cephalic or normal presentation. Now the next important contraindication is a cephalopelvic disproportion (CPD). That means the head of the fetus is size of the head of the fetus is greater than the pelvic outlet. In that condition, oxytocin is also contraindicated. It is all about the oxytocin. Now the next examples of the oxytocics is the ergot alkaloids like ergometrin, and we know that ergometrin is also called ergonovin and methyl ergometrin. The pharmacokinetics, these are the given may by oral, intravenous, intramuscular, and their onset of action, they start their action is very fast within the minute. And these are drugs primarily used in case of the PPH. Okay. Especially if patient is pregnant lady is not hypertensive, this drug is preferred, especially in case of the PPH. If patient is hypertensive, this drug is not preferred because ergometrin-like drugs have a vasoconstrictive property. That's why may rise the blood pressure. That's why not used in hypertensive patients. Now the mechanism of action, how does it works? These are drugs have a partial, they act by the multiple ways. They have a partial agonistic activity on the 5-HT receptor, alpha adrenergic receptor, and also have some property on the dopamine receptor. And it all stimulations lead to the smooth muscle or uterine muscle contractions. Now the differences between what is the basic differences between the ergometrin and oxytocins. Basically, in the term of their uterine contractions, ergometrin causes forceful and prolonged contractions with no relaxation between the contraction. But why? In case of the oxytocin, full relaxation occurs in between the contractions. These are the basic difference. Now the clinical uses of ergometry. The first indication is uterine attunement. Sometimes we have seen after the childbirth, the normal contraction of uterus is very feeble, very big. the tone of the uterus muscle is lost. In that condition, we have used ergometrin to retain their tone. Also, ergometrin lecture we have used in third stage of labor to prevent the PPH, postpartum hemorrhage. Also, these are drugs we have used in case of cesarean section or instrumental delivery to prevent the uterine atony. And these are drugs also sometimes we have used in case of the sub-involution. Sub-involution means sometimes after the childbirth, the size of uterus is not returned to the normal size. Okay? Size will be reduced. In that condition, ergometry like drug we have used to regain their original position or size. Now, the adverse effects of the ergometry, like uterine hypertonicity. We know that have a uterine contraction property. That's why may cause uterine hypertonicity, may cause rupture of uterus, may cause cramping of uterus. It's have also vasoconstrictor property, may raise the blood pressures. Now the last part of the oxytocics is the prostaglandins analog or derivatives. So so many drugs, so many prostaglandin derivatives nowadays used. First one is mesoprostol or genprostol, dinoprost and carboprost. These are all are drugs given by the either oral, intramuscular, or as a pessaries. Now the what is the mechanism of action of the prostaglandin? We know that prostaglandin is the strong uterine contractile properties. That's why I have used, especially this type of the drug we have used for the termination of the pregnancy or the ripening of the cervix. Okay. Now the see the here indications. Different derivative of the prostaglandin we have used in termination of the first trimester pregnancy, mesoprostol, genprostol as alternative up to the 63 days. Nowadays, mesoprostol also we have used along with the mifepristol. Termination of second trimester pregnancy, extrahepatic dinoprostol we have used. Stimulation of cervical ripening. What is the cervical ripening? Cervical ripening, the cervix is prepared for the childbirth. That is it. That is the cervix is a softened, thin, dilated. For this purpose, we have used dinoprostol. Prevention, the PPH also sometimes we have used if your primary drug like ergometrin and oxytocin is your patient is not respond by this drug, then you have tried to the carboprost intramuscularly. Now the adverse effect, nausea, vomiting, diarrhea. We know that prostaglandin is one of the inflammatory mediators that may cause fever, inflammation. Uterine pain may cause. Okay, my dear student, do you have any question? No? Okay. Do you have any doubt? No? Okay. Now move to the self-assessment part. I have some question. First question is, a lady in third trimester of pregnancy was induced by oxytocin. Select the best reason why oxytocin is suitable to be used for the labor of induction. Now options are, it causes coordinated uterine contraction with full relaxation between contraction. It causes second B is it causes prolonged contraction of uterus. C, it causes softening of the cervix. Third, increases prostaglandin synthesis. Promotes. A is right answers. We know that they produce the rhythmic uterine contraction will provide a full relaxation in between the contractions. Second question, both oxytocin and ergometrin have a following properties. Act at the same receptor, no, soften the cervix, facilitate the labor, prevent the PPH, facilitate the milkage. Dear student, what is the right answer? D is the prevent the postpartum hemorrhage is the right answer. Now the next question. Oxytocin is produced in the hypothalamus and secreted oblastin by the posterior pituitary gland. Select the following condition where oxytocin is contracted. Yes, my dear student, please recall my lecture here. First one is a breast engorgement. No, oxytocin is used in breast engorgement because its property have eject the milk. Induction of labor. No, placenta previa postpartum hemorrhage uterine. Choose placenta. We know the placenta previa is right answer. C. On the next question, a 35-year-old woman develops severe hypertension and headache after receiving an injection for the postpartum. Which drug is responsible? Options are oxytocin, aromatase, vasopressin, carbo, etosan. Okay. Here, etosan is the oxytocin receptor antagonist. Here, the right answer is the argometine. We know that argometine has vasoconstrictor property may rise the blood pressure. So here B is the right answer. Thank you, all of you.